Cancer information, as we know it, is fragmented and broken. Patients receive a myriad of clinical information at diagnosis, which is confusing and bewildering. We set out to change that by producing information in a creative, non-clinical format. We developed peer education, information by patients for patients, professionally produced. This is not just about how we do information, it is about the future of our nursing workforce. It's multidisciplinary innovation, nursing-led, patient-centred, data-driven. That's where one step at a time comes in. Today, we know we are directly addressing health inequalities, assuring people about coming back into hospital with a cancer and COVID information film. With funding from the Cancer Alliance, we produced our peer education videos in 5 different languages. 1,513 people locally have scanned the QR code and got to the videos online. 389 nurses, doctors, staff in person have attended our West Downs at a primary care conference in meetings with GPs from the Mid and South Essex Integrated Care System and in Herts and West Essex ICS. Also on BBC Essex Radio when we advertised our cancer conference, Fight Cancer with Hope, and to the students of Harlow College. Also, we did some sessions with the Anglia Ruskin University students at Chelmsford College. Cancer has no respect for age, gender or ethnicity. It doesn't matter who you are or what you do. Nothing can prepare you for being diagnosed with cancer. Accepting the post of Macmillan Primary Care Nurse Facilitator was both a leadership role and an opportunity for me to improve cancer education and cancer pathways in West Essex. Just 7 days after commencing the job, I faced untimely news. Although I had a feeling that something was wrong, not even my 30 years experience as a nurse could prepare me for the news. Nothing can prepare you for being diagnosed with cancer. It was such a shock. I wondered, how will I tell my family, my friends? What will their reaction be? Sometimes breaking the news to loved ones is harder than hearing it for yourself. Returning to the role in January 2020 gave me a new perspective. I had a completely different outlook, a responsibility to share my experience as a lived experience cancer patient. This was the catalyst to making a change and would fundamentally transform my approach to patient care. A chance meeting with Anne Nutt and Shahid Sada was pivotal.
This is real co-production. We began with patients and kept them at the centre. So we began with a cup of coffee, and even during the pandemic, we still continued to meet. We held a cancer conference in person with COVID controls, Fight Cancer with Hope, attended by 80 people. 55 of those were in person. Many cancer patients, led by our patient panel and lived experience partners, supported by science students at the wonderful Harlow College. As a result, we've produced a patient information card for our hospital with QR codes linking the videos. Today, the initiative is being used by the Lister Hospital, Watford Hospital, and it was easy to adapt. We have the backing of our integrated care system, our Cancer Alliance, who have published the videos on their website. There were obstacles, but we have found resilience in each other. In a very challenging time, it is still possible to achieve despite the barriers. The pandemic did not deter us. In fact, it gave us more opportunities to network and connect with other patients and key stakeholders. We met every Thursday morning for a virtual cuppa or for 1 hour. That's probably the secret. We knew we had to reach patients and encourage them to step forward to see their GP and to not ignore vital symptoms of cancer. So our video, Cancer and COVID, detailed the experience of a practice nurse who was diagnosed with breast cancer during COVID. There have been obstacles, but all obstacles can be overcome with a vision and a driving ambition when looking at things from a patient's perspective. We stuck to that vision throughout. As a result, the professionals are coming to us.
So I got involved when the National Cancer Patient Experience Survey started showing evidence that the emotional concerns of patients weren't being adequately addressed. And an example of this and why we need this work is the heartbreaking story of Ben. He was a young father who didn't tell his daughter he was being treated for bowel cancer. And one day his 4-year-old daughter said to him, because she's clever enough to work out what was going on, she asked out of the blue, "Is Daddy going to die?" So it's families like Ben's who would benefit from this project. It's stories like that that drove a vision to address a problem that we have not yet found the right language, the right way of speaking about cancer with our family, our friends. We read reams of clinical information at diagnosis that distances us at a time when we are already too distanced. So when I met Emma, who told her story, she embodied that duality of perspective and that leadership, open-minded, dynamic, and gently transforming the landscape of care without making a fuss about it. That's what this is about. So when you read the student evaluations of the project from her teaching, you know that this is going to change their practice. And I'll give you a moment to just read some of those evaluations. So one step at a time, what's next? We had a shared goal to amplify the patient voice, to produce information by patients for patients. Emma's journey became our journey, and we want it to be yours. This is not just about Emma or this team or cancer services. This is a social movement founded on nurse leadership to change the conversation. So we want to take ownership of the stories and tell the stories about our health and well-being that we need to be able to tell. So one day it's safe for that father to say to his daughter, "I'm not well, I've got cancer, but we're going to get through this together."
So our vision is nursing-led, patient-centred, data-driven, and your mission is to help us get there. Thank you.